Hi, my name is Halima Chowe. I'm a project manager in NHS England.
Hi, I'm Colbert Ncube. I'm Interim Director of Transformation at Southwest London ICB.
Thanks for meeting with me, Colbert. So I'm just going to ask you a number of questions. The first one being, what has attracted you to work in the NHS?
So I finished university in a recession and I wasn't sure what I wanted to do career-wise. And I came across the National Skills Academy grad scheme, which I applied for and was successful in. And that placed me in a local mind and working with the commissioners at that point made me want to effect change at a more strategic level. So I then started to look for roles in the NHS. And once I was in the NHS, I think it was making a positive difference to people's lives and also being a part of improving quality of healthcare for the population.
That sounds amazing. How do you and colleagues generate great ideas in your organization or system?
So we work as a team to include our patients, carers, and the local population in generating our ideas and plans for improving services, as I think we need to acknowledge that they are the best placed people to help us to identify what works for them.
So how has the NHS supported you to grow and develop in your career to get to this point?
I've been fortunate to have great managers and mentors who've supported me along my journey and given me the necessary time and space to pursue development opportunities. And I've also been fortunate to receive funding from my organisation for part of my master's. And I was supported by my organisation to manage my workload while studying as well.
That sounds like great support. What roles have you had along the way?
So I've worked in a charity as a graduate management student, and I've been a planned care commissioning manager. I've managed dental contracts for regions, and I've been a head of service for mental health, as well as a deputy ops director for in a mental health trust. And I'm currently in an interim director of transformation role.
So you mentioned support from your manager. Tell me about a mentor who helped you during your career. How do they support your progression?
So I've got a manager from a previous role who I'm still in regular contact with, who's a great sounding board and is always available to test things out with me and work through any areas I'm finding challenging, and is a big driving force in around me doing my master's, and is always a sounding board when I'm thinking about the next steps to take in my career.
And how do you continue to grow and develop as a leader?
So I think through mentoring, coaching, and continual learning, so reading books around leadership and management, and I think constantly working on areas that I identify with help from my direct reports or my line managers around how I can improve my leadership.
That's great. What talents do you use in your role?
So a lot's around people skills, partnership working, adaptability, and creative thinking. So thinking about how you deal with the day-to-day and strategic challenges that we faced in our system. And I think people skills are really important because you have to be compassionate and empathetic to the workforce that is working in a very challenging time for the NHS, whilst also thinking creatively around solutions to the challenges that we're facing and bringing in partners to own system challenges and develop system solutions.
I absolutely agree. What do you find the most rewarding and meaningful in your current role?
I think it's making a difference for the population I serve. I think as a Black male working in a very diverse part of London and knowing the health inequalities faced by the population, it's very important for me to make a difference for those groups and ensure that their voice is heard, and that when we're developing services, they meet their needs and improve the outcomes for those underserved communities.
That's amazing. Who has inspired you along your journey and how?
So I think for me, it's rather than it being a person, I think it was the point when my career led me to London and I first started to see people that looked like me in senior positions. And I think that gave me the internal license to aspire for more and want to be like them and be at a level where I could be part of creating the inclusive culture that hasn't always been present in parts of my career and in the NHS as a whole.
And what advice can you share with people aspiring to be a senior leader? within the NHS or the wider system?
I'd say take opportunities as they come and be open to moving out of your comfort zone, as that allows you to grow as a leader.
And if you could advise two things to yourself at the start of your career, what would you say?
I'd say believe in yourself and take more chances.
And what is the most important risk you have taken and why?
One of the most important risks that I took was moving from what was then CCG commissioning to work in national policy for NHS England. I think there is a risk that sometimes when you're sitting in a local system for a while, you don't quite get to see the wood from the trees. So I think that helped me see the bigger picture and be able to challenge myself to strive for more and be more creative in the service delivery and transformation work I was doing. And that also led to being part of the team that wrote the mental health element of the long-term plan, which was an invaluable experience. And due to that, my experience with NHSE really opened up my career options from then on.
It's amazing you talked about mental health. How do you maintain your health and well-being at work?
So I think thankfully my character is such that I'm quite good at switching off from work, and I do try and compartmentalize my work. What I do is when I've finished working, I like to process my work day, and once I've finished processing my work day, I can separate work from my personal life with my family. And I like to find activities that keep me de-stressed. So I think about reading a lot, cooking a lot, and fitting in travel within my annual year plan, so I can have moments where I'm not really thinking about work and I'm just relaxing and in the moment.
And what advice can you share with others to maintain their health and well-being and occupational balance?
So I think for me, it's finding what makes you happy outside of work and making sure that you make time for that. And I think also making use of support offered at work around well-being. So there's a lot of well-being support for NHS staff that I would say people need to look at their organisation and see what's available.
What challenges and barriers have you faced along your journey, and how have you overcome these?
So I think in terms of my journey, I think a lot of the challenges have been my own self. So in thinking about what's in my mind, thinking about around imposter syndrome, for example. And I think some of those challenges you can overcome those by coaching and mentoring. So having people that you can talk to that can support you around that can help you overcome those challenges.
And what is your advice to colleagues on how they can progress to senior roles?
So I would say it's thinking about getting linked in with coaching and mentoring and any development opportunities that are available. So like the Leadership Academy, which will support with personal development and also can support with potential work placements that can open up your career progression pathways.
Well, thank you so much, Colbert. That was our last question, and it's been amazing speaking with you.
Thanks, Halima.